From ABC4 News, Coronavirus Preparation versus Panic.
Thank you so much for joining us tonight for this special presentation, Coronavirus Preparation versus Panic. I'm Glenn Mills. Right now, most of the country is under stay-at-home orders, schools are closed, and unemployment at record levels. In a Kaiser Family Foundation poll earlier this month, 45% of people said stress related to the coronavirus had a negative impact on their mental health. We could all use some tips on improving our mental health right now. For more on that, I am joined by Monette Cash, a licensed social worker from St. Mark's Hospital. She joins us from the backyard studio. Monette, great to have you with us. Thanks so much for being here. This is such an important conversation and something I've really been worried about because I don't think it's getting enough talk right now. So let's get right into it. What are some ways that can be helpful to really reduce stress during this very stressful time?
Well, you're absolutely right. A lot of people are really struggling right now, especially with anxiety and feeling overwhelmed with uncertainty in general. So one of the tips that the mental health professionals are giving right now are, to stay connected. There's, I think, a lot of my colleagues that were frustrated with the term social distancing. We wish it was physical distancing because a lot of people are really isolating themselves socially. And that, as you know, can lead to depression and actually make our anxiety worse. So staying connected socially is really important.
And let's get into ways to do that. How's the best way to stay connected socially? I mean, we have FaceTime and other opportunities as well.
Yeah, that's the good news is we actually have the internet now where, as other previous years in history, we didn't have that. So that is something we could use to our advantage. There's an example that I just saw in my neighborhood yesterday where they had divided the street and there was barriers and they were playing pickleball on either side of the street and they had their gloves and masks on. And I thought that was an awesome way to stay connected with their neighbors and in a safe way. Another example is, there's a lot of apps online. So there's one I think called Nextdoor that one of my clients used last week. She's a single mom. And her daughter needed some art supplies and she didn't have any, and so she put that on that app, and within 15 minutes she saw on her front porch that she had art supplies delivered for her child. Yeah. So I thought that was a really cool story and just a really awesome way to stay connected.
I was out at Jordan Landing on Saturday out at a restaurant there, and I saw families in the parking lot. Kind of their vehicles were in different spaces in the parking lot. They were tailgating. And that was also what appeared to be a very safe way to stay connected as well.
I love that. Yeah, that's a great example as well.
Okay.
There's ways to do it.
Yeah. So what are some specific coping skills people can try when they're experiencing things like anxiety and depression?
So there's so many, right? But one of the most important, probably one of the most effective that anybody can do is, number one, to focus on what you can control and let go of what you can't control. And probably the most important way you can do that is by staying focused in the present moment. We know that there's a lot of predictions about what's happening in the future. We can say, what if? We can think, what if? We can do that in front of our kids and make them anxious as well. Or we can really stay focused in the present moment. So I actually teach an exercise to my clients called grounding. And in this grounding exercise, I just have them tap into the 5 senses and really pay attention to where they're at and smells and sights. It was a warm day today. We can get outside and we can smell the fresh air and we can, look at some colors. There's a lot of flowers out. And just tapping into that present moment and staying very present with whatever we're doing and mindful with whatever we're doing, that will really help reduce anxiety a lot.
Okay, so people are experiencing things they may not have before this pandemic, but others are dealing with pre-existing mental health conditions. What advice do you have for those who are probably feeling even more overwhelmed now that we're in the middle of this pandemic?
I'm so glad you asked that because, I cannot ignore the fact that actually we've seen a rise just in the last 4 or 5 weeks in domestic violence. We've seen a rise in child abuse. This is really taking a toll on relationships in general, right? People are either, most people are at their worst, but people can also be at their best. So people with pre-existing conditions like kids with ADHD or people with anxiety and depression, those are the ones that need to seek support a little more actively. And there's actually shelters that are open. There's numbers that you can call. There's ways that you can reduce that loneliness and get extra help so that, and you have to work a little bit harder when you've got a pre-existing condition. Yeah. And so speaking up and asking for help and letting people help you is very key for people with mental illness to begin with.
Let's dig into that a little more, specifically people with children. Right now, children are at home all day long. Parents aren't used to that. It can be taxing. What advice do you have for those who are now dealing with children more than they have in the past?
So one thing we need to remember about children is they're usually not very verbal. They're not always going to tell us how they feel, but they will act out, right? So you can pretty much expect tantrums. You can pretty much expect them, being loud and losing their cool. You pretty much just need to expect that. But one of the things that you can do is allow them to express it. So any kind of art projects, chalk the walk is kind of a popular activity right now. I know my grandkids were out there chalking the walk. And, just doing anything tactile with their hands or any form of expression other than verbal expression can really help the parents and the kids as well keep their peace of mind.
Yeah, I've been seeing a lot of that myself, and it looks great, actually, out in the community as well. All right, let's talk about one last thing. Right now, a lot of people are feeling anxiety, depression, feeling down. At what point do you need to realize, look, I need to go even further with this and get some professional help, or I can manage this on my own? What advice do you have for us then?
Well, of course, as a mental health professional, I'm always going to encourage people to get help, right? The issue at hand right now that's interesting is the duration. So I think anybody can struggle with depression or anxiety for a few weeks, but I think we're going on, week 5 or 6 here? And so the duration and the length of time is really taking its toll. And so I encourage people to reach out now. There's a lot of online support groups. There's a lot of apps that can help reduce our anxiety. There's one called Calm, where they do a lot of breathing exercises that can help. I do telemedicine and teletherapy. So I know that there's many websites where you can actually seek counseling online, and there's a lot of therapists that are doing that right now. I'm very busy, and I know a lot of my colleagues are as well. So there is always help available.
Yeah, I would imagine you are. Thank you so much. Again, a very important conversation. How can people get in contact with you?
So the best way is just our website at stmarks.com, stmarkshospital.com would be probably the best place to go, and we'll post a lot of resources there for people as well.
Okay, fantastic. Monette Cash, thank you so much for your time tonight. We really appreciate it.
Thank you.